FDA got a lot of people's attention this week, giving the official go-ahead for a new way to get rid of a double chin. It involves injections, and it looks like, if you take a look right there for yourself, it looks like it really works. But like anything else, there are potential problems to be aware of. Dr. Anthony Brissett is the director of the Facial Plastic Surgery Center at Baylor College of Medicine. Joins us now to talk more about Kybella. Good morning to you.
Good morning, Melissa.
You wouldn't believe how many questions I'm already getting about this. As a reporter, people wanting to know when it's available, what is it, does it really work? Start from the beginning. What is Kybella anyway?
Well, Kybella is also known as ATX 101. That was the scientific name of the product, and it's essentially deoxycholic acid. It's a bile salt, and it's a naturally occurring salt within the body. And essentially what it does in the body is it breaks down fat. We see that within the intestinal system. So what Kybella, who is the company that produces Kybella, has done is they've essentially made a synthetic bile salt that is able to break down fat cells, and it does that by rupturing the cell membrane of the fat cell, and once that cell membrane has been ruptured, the body then dissolves that fat and resorbs.
Okay, so the injection goes in. How many injections does it take, and does it actually go into the chin? You said the neck as well?
Well, it's designed to remove submental fat, and submental fat is the fat that we see just underneath the neck. And for some patients that have lost the weight that they've wanted to and are not able to remove this fat, it's essentially exercise-resistant fat. And so in a series of small injections underneath the chin, in this submental area, it can be placed. It's placed in about 10 to 15 minutes. There's anywhere between 2 and 6 sessions, and typically it's about 30 days apart.
Okay, now let's talk about your concerns. It's new. It's been in studies for a couple years. So far, it's looking great. You just don't know long term. 10, 20 years down the road, what will happen?
Absolutely. You know, and nobody knows. And the FDA and Kybella have done an excellent job doing extensive studies on the product itself. However, you just don't know what those extreme long-term results may be. Now, some of the short-term results are what you would expect with any type of injectable product. You may have some bruising, some swelling, maybe some redness. Those were the most common results. And when you look at the studies that over about 70 to 80% of people have those types of predictable short-term results.
Sure, and I think anyone who's ever got an injectable expects that, so that won't be a surprise to this particular patient.
Absolutely.
Let's talk about the fact that if you are able to pull this off with a chin, is there any other body part that you can do? I would think, as I picture body parts, I would picture everything being bigger, so it would take a ton more injections, but could this product be used to help in the future?
That's an excellent question, Melissa. And the concept for the product and the mechanism for the product will essentially allow you to break down fat in other parts of the body. It just does what it's supposed to do. The approval for the product is for this small area. Certainly, there may be people that decide to do what's called off-label use, but to do an off-label use and use abdomen or other aspects of the body would require a large volume, and that hasn't been tested, and so we really don't know what that product will do.
And I just have to ask you, when you're getting rid of that much more fat that your body normally wouldn't have gotten rid of, your kidneys and everything can filter that and flush it out without causing any problems elsewhere?
Well, in the submental area, yes. It's a small amount of fat, a tablespoon of fat in that area, and a small amount of product. But certainly the concerns for metabolism and breakdown have been addressed in the past.
Well, everyone's going to be looking at the dollar sign for this one. Any idea what it's going to cost yet?
I don't know. That's a great question. I don't know the dollar sign.
Probably looking at demand right now and seeing how many people want it, and then they'll decide.
Absolutely. Okay. I think so.
And you think it'll be available midsummer, maybe?
Well, you know, some of the keys to success for this product is going to be to make sure that the physicians are appropriately trained. So physicians will be trained in early June, and they're expecting a rollout of this product sometime in the late summer. All
right, we'll check back in with you, see how it's going. Dr. Brissett, thanks for coming in for Baylor College of Medicine.
Thank you so much, Melissa.
No more waddles, as they used to say on the Ally McBeal show on Fox. Jose.